Is your vacuum like your arch nemesis? You are not alone. I'm Dr. Megan von Holtz, and I'd like to spend a few minutes with you going over some things that you can do to try to decrease back pain while vacuuming. Now, true confessions. I hate vacuuming. I've been known more than once, 10 minutes before company comes, to vacuum the entire house as fast as I can with humongous sweeping motions, reaching as far as I can forward. This, ladies and gentlemen, is a perfect example of how not to vacuum. And let me show you why. If we look back at this spinal model like we've used in other videos, we can see what a normal disc looks like. It's almost like a jelly donut. It's squishy on the inside and firmer on the outside. Even in a perfectly normal disc, the weakest area is back here. So if we bend forward and twist, guess where all the pressure of that disc is going? Exactly, right back here. And this is how we're going to injure ourselves. So in my poor model, when I'm bending forward and twisting and reaching as far as I can, that is right where all that pressure goes. The other thing I want you to think about when you're vacuuming is think of it almost like a fitness activity. So if you're going to the gym, you're going to stretch first. So before you vacuum, spend 5 minutes walking around the house, even march in place in front of the TV, try to get warmed up, and then you want to do some low back stretches. Now honest, my favorite thing to use to do that is one of these Pedibon wobble chairs, because it's actually specifically designed to stretch those muscles, to improve the fluidity and the youthfulness of the disc as well. Now, if you don't have a wobble chair that you can take home with you, even just doing the 6 normal motions in your low back can be incredibly helpful. So, for instance, bend your knees a little, and you're going to kind of just flex forward, say 30 degrees, and backward, and maybe do that 20 or 30 times, and then you're going to, actually we'll twist next, do that 20 or 30 times, and then you're going to lean. And that will really just help warm up the discs in your low back. Now, I really feel like there's 3 ways to vacuum that are adequate that shouldn't hurt you. And which one you're going to choose is really dependent on your fitness level and any injuries that you have. The first one I've nicknamed the Tin Soldier. This is going to be for people who have low fitness or have knee injuries. All 3 of these, we're going to really try to hold up our spine, like shoulders back, tuck in the tummy, and try not to bend or twist like we talked about before. So that first one, you're going to stand up with great posture, and all you're going to do is reach that arm as far forward as you can without bending forward. If you start to bend, you need to stop. So that's all that it is, just forward and back, and you can do it on either arm. Now when you look at that, you can see you're not going to cover very much ground. This is going to take 4 times as long as any of the other methods. But there's nothing that says that you have to vacuum the whole house in 1 repetition. You could do it 20 minutes at a time, or even pick 1 room a day so that you don't hurt yourself. The second method I call the lunge, and this is for someone who's got a little bit stronger legs or who wants to work on their leg fitness. So with this, you want to try to be opposite. So if my right arm comes forward, I want to use my left leg, lunge forward, and reach as far as I can with my arm without bending forward or twisting. So we can do it on this arm, or we can do it this way. So you can get a lot more coverage when you do it that way. It'll be a little bit quicker, but it's going to be tougher on your legs. The third way is called the squat, or I nicknamed it the Spider-Man. You're actually you can squat down, and when you do that, you're using a lot more leg strength, but you can move around a whole lot more. I've got a lot more kind of mobility and directions that I can go, and you can move a lot faster. But when you're done, your quads are probably going to hurt a little bit. It's a good workout. Really, any of the 3 of those are great ways to vacuum, much better than the way that I showed you in the beginning. Again, I'm Dr. Megan von Holtz. Thanks for joining us for the Tip of the Week. Join us next week.